Well, so my job this morning is to let you know about obesity from a pediatric standpoint. And I think we should really start with the concept that obesity is in many ways a life course disease. It can occur throughout the lifespan, but just as you saw the maps indicating an increasing prevalence of obesity in adults, there has been a similar increase in the prevalence and the severity of obesity in the pediatric population. And this slide shows some of those the most recent prevalences. And what it also demonstrates is that this is not a uniform effect, that there are definitely some racial ethnic groups that are more severely affected than others, and also some differences based on sex. Now the question would be, why would this be occurring in this period of time? If we went back to the 1970s, the prevalence of obesity in children would have been about 5%. And now we're talking about numbers of around 15 to 17%. So what's happened in that time? And I think that's some of what we'll be discussing during the rest of the morning. But clearly, there's been an impact, maybe an intersection is a better way of putting it, between our genetics and our biology and our environment. And what we've found is that normally we live in a balance of energy where the energy intake basically supports our metabolic needs, and in the case of children, the needs for growth and development. And what we've seen is an excess of caloric intake and a decrease in physical activity. And over time, if we're even just a little bit out of balance, excess weight gain can occur. And you could say that our biology really is designed around a time when food was scarce and difficult to get. It took a lot of physical activity to get food. And so we've become very efficient biological organisms to maintain energy, to store it, and actually defend it, which puts us in a bad situation for the current environment as we have an energy excess, calorie density in many of our foods, and a deficiency of physical activity. So our thinking about obesity has evolved in a number of ways. And one of the important things to think about is the impact of obesity on health. So this slide shows that obesity essentially affects just about every organ system in the body. So you can see from the cardiovascular standpoint, it's a risk factor for hypertension and atherosclerosis and ultimately cardiovascular mortality. From a metabolic standpoint, it affects insulin resistance and ultimately type 2 diabetes. It's a risk factor for dyslipidemia and what's called the metabolic syndrome, which is a clustering of risk factors now associated with increased risk for cardiovascular disease. It has gastrointestinal effects, probably the most important being non-alcoholic fatty liver disease. This is a liver disease that develops over time with fat deposits, but can ultimately progress to more severe liver disease, including hepatitis, fibrosis, and is becoming an increasing cause for need for liver transplantation in adults. And some have argued that it, over time, will become the most common reason for liver transplantation in our society. From a pulmonary perspective, obstructive sleep apnea is an important problem. That's related to a variety of other downstream effects in terms of cardiovascular disease. In children, we see orthopedic effects of obesity. There are neurologic effects. And ultimately, there are also the psychosocial kinds of effects of obesity as we live in a society that really promotes thinness in a variety of ways and sets up a difficult situation for individuals who are overweight and obese. So We have an increased prevalence of obesity and an increased severity of obesity in children, and this has resulted in an increase in the prevalence of type 2 diabetes. Now, many of you will remember a time when we used to call type 2 diabetes adult onset diabetes. This was because it was uncommon for children and adolescents to have type 2 diabetes. In fact, it was the kind of situation where when a patient presented, you would call everyone to the clinic or the ward to see the patient because it was really, at that time, an anomaly. Now, unfortunately, type 2 diabetes is a more and more common occurrence in adolescents, and it is almost exclusively a disease of obesity where the body becomes increasingly resistant to the action of insulin. Ultimately, that results in increased production of insulin and higher circulating levels of insulin. And over time, the beta cells in the pancreas, the insulin-producing cells, wear out and can no longer produce enough insulin, and type 2 diabetes occurs. So what can we do about this problem? Well, it's a very frustrating problem, as you'll hear throughout the rest of this session. Probably the optimum approach to obesity is preventing its occurrence in the first place. And this is why pediatrics is such an important aspect of this discussion. But unfortunately, we're seeing obesity occurring at increasingly younger ages. In a clinical setting, it's now not uncommon to see 3-, and 4-, and 5-year-olds who are presenting already with obesity. The treatments that we have in pediatrics, as Ron indicated, are often a trickle-down from treatments derived in adults. And so the situation there is pretty pessimistic as well. We have virtually no medications available for treatment, and while some adolescents will qualify for bariatric surgery, in pediatrics it really is used as a treatment of last resort, and it's reserved for patients who are very severely overweight and who already have severe metabolic complications of obesity. So that leaves us with basically working on behavior change, focusing on diet and physical activity, which I would argue in our current environment is really quite difficult for patients to accomplish. It's not impossible, but it's very difficult. And so this forces the pediatrician into the mode of really having to manage obesity as a chronic disease, really having to focus in a team effort with usually dietitians, sometimes psychologists, sometimes exercise physiologists, on helping families make changes in the environment. First of all, to hopefully prevent excess weight gain, but ultimately to treat obesity. So there's a lot more that we need to be able to do to prevent this onslaught of obesity that we're seeing, and you'll hear from the other speakers approaches that are in the pipeline that may or may not turn out to be beneficial.